Welcome to CEO IntroNet. I'm your host, Patty Owens. There's no greater priority for our country right now than healthcare reform. We're going to meet three executives who have different ideas on how to gain an operational edge in healthcare. Let's meet our members.
Thank you, Patty. I'm Peter Adamo, Regional Chief Executive Officer for Roxborough Memorial Hospital and Lower Bucks Hospital.
I'm Chris Powell, President of Precyse in Wayne, Pennsylvania.
Hi, I'm Mark Victor. I'm the CEO of Cardiology Consultants of Philadelphia. My base office is in Center City, Philadelphia. We have nearly 30 offices across the greater Delaware Valley.
All right, so welcome to all of you. You know, there's such a fray of perspectives, such an amazing array of perspectives on what healthcare needs in order to get better. But everybody agrees it needs to get better. So what explains the divergence of opinion between, oh, we've got to put everything into electronic medical records to, oh, we've got to have accountable care organizations? What explains all of these perhaps conflicting perspectives? What do you think, Mark?
So I think that a lot of the drivers of the need for change is the understanding that there just is not an unending supply of money to keep feeding into the system. And so as everybody's kind of tried to draw a line in the sand and say, okay, well, this is how much money of our entire budget of America we can spend on healthcare, we need to start working more efficiently. And traditionally, there haven't been a lot of aligned incentives to work efficiently. So the physicians kind of work in their environment, the healthcare professionals work in theirs, the hospital systems work in theirs. Patients are kind of left figuring out what's best. And I think that the opportunities between better use of technology, better attention to the quality of the care as opposed to just the quantity of care, I think those things are at least beginning drivers in getting us to the right discussion.
So there's consensus around a commitment to quality. There's a consensus around a commitment to efficiency. We actually, in fact, are sort of a petri dish, right? Because we've got a hospital executive, we've got a software executive, and we've got a physician. And I'll be the patient, for lack of a better role. So let's think about it from the hospital's perspective.
Yes.
Does what Mark's saying make sense?
It makes absolute sense. I think that's the macro issue. More fundamentally, I think we need to question how it is that we finance the expenses associated with healthcare. The first thing we should realize is, unlike most other forms of business, the entity paying for most care is not even in the room when it's performed. So that alone drives up costs because you now have to substantiate what you've done so that you can have at least a fighting chance of being paid. With that comes a certain removal of consumerism. If you're not paying for something and reaching to the wallet, it's so easy for the price to rise, and that creates a new complexity. And I think some of the modern day regulation is designed in an attempt to restore some of that consumerism.
So let's bring the voice of the consumer to the table. Chris, join the fray here because you're dealing with the electronic medical records and data and the patient in a different way than our other two guests. Tell us what you think about.
Yeah, I think there is so much information available in healthcare now that really there's a growth of information about patients, but it's not all coordinated and it's not all in the same place. So that as a patient in the system, you move around the system, but that information doesn't go with you. That creates cost. It creates quality challenges for healthcare. So the opportunity is to coordinate all that so that ultimately, when I go to the cardiologist and then I'm admitted into the hospital, my information flows seamlessly. I'll get better care and it'll be more efficient over time.
And it seems as though we're heading in the right direction, perhaps 2 steps forward and maybe 1 back. But who will be the quarterback of this kind of change? I mean, will it be the payer, as you suggest? Will it be the patient? Will it be the professionals, the hospitals and doctors combined? Who's going to drive? Who's going to be really in the driver's seat?
And I think it may be very regional in the answer to that question. We were talking earlier, a group of us, and the Geisinger model has been used over and over again as an example of a success story about population health management. And that works great in a place like Geisinger, where here in Center City, Philadelphia and the immediate suburbs, there's 30 hospitals, there's thousands of physicians, there's 5 academic health centers that you can walk or at least ride your bike to, as opposed to across states. So I think it's going to be very regionally driven, but I do think that the fact that the debate is underway, I think that there will become a variety of stakeholders, whether physician voices, hospital voices, industry voices with software and technology helping to meet that incredible need of making sense out of the noise. But I think that there'll be different answers in different parts of the country.
Yeah, that makes sense.
If I could add to what Mark's saying, I think there's two other groups too, I think, that'll have a powerful voice. One is the employer. And, I have 1,200 colleagues, and I worry about their care every day. And my cost goes up every year, right? So I think employers are getting much more engaged in wielding influence. And I think the other big constituent, which we all know, we're all part of this system, which makes it unique, right? And is the patient. As we're paying higher deductibles, we're paying more for our care, we're going to demand more. Information will allow us to choose. And choice isn't something, when you're sick, you want to feel better, but you also want to feel better at a place that you think you can get the best quality.
Well, it's interesting because I think technology has supported the voice of the patient in this process because medicine has been demystified in my lifetime, and it will continue to be ever more so as we go forward. So what does that mean for hospitals when your patients are walking in the door already diagnosing themselves, right? They've already looked up on WebMD what they may have. What is...
Well, you've got to be that much more sharp. You've got to be able to provide further value, and you've got to be able to use the information that hopefully you'll share from one organization to the next, so you're more perfect about what you do, and you're further up the ladder when you get started, which leads to a point I'd like to make, which is the ability to collaborate. As we can transfer information from provider to provider, it would be that much easier for centers of excellence that don't have to be established on every corner, where you've got resources that are only partially utilized, now can be in key areas of the community that you're serving, and not everybody's going to have a fancy gizmo, which is only used at 20% of capacity. We can bring information from one entity to the next and be just as perfect as you would if you stayed in the same building.
So if collaboration is part of the prescription for a better America in American healthcare, what would you add to the prescription? What would be the one thing you would wish for that would really advance this conversation?
I'd like to see the ability to see a doctor for a rather reasonable price and not have to bill a third party to do something as simple as an ordinary doctor's visit.
We'll add that to the script. What would you suggest, Chris?
I think having access to all of my information as a patient and all the time I've had care at the orthopod and the primary care physician and trying to be a weekend warrior athlete, I'd like to see that move with me from encounter to encounter, and I think my care would get better.
All right, so Mark, you're the only real doctor at the table. You get to actually write the script.
Right.
What would you suggest?
So mine is going to tee a little bit off of what my colleagues have said. To me, what I really want to see happen is the ability for me, because you're the patient in this enterprise today, for me to be able to look at your care delivery over a whole host of previous providers, a whole host of previous hospital encounters, and look at it from my own laptop and be able to have universal access to your data, HIPAA compliant with your consent, so that when you're asking me to take care of you today in the office, I can take care of all of you today in the office, not little bits and pieces that are temporary in their allotment as opposed to totality of access.
So a systemic answer. I think you're all adding your voices to a collective outcome. So as the patient, I am cured. I want to thank our guests for their insight and their fabulous medical advice. I'm Patty Owens. Have a great day.